Good morning. This is Steve Stites at the University of Kansas Health System. I'm in the Dolph Simons Family Studio, and I have a mask on. And we're going to go right to that as a question. I am joined this morning by Dana Hawkinson. Good Lord, I can never get through this part of the sentence correctly. I pray about it every night. Dana Hawkinson, Doc Hawk. He is the Medical Director of Infection Disease and Control. Infection Prevention and Control, and I'm also joined by Amanda Gartner, who really runs the whole thing, and she is the director of what we call IPAC. And we were in the studio this morning debating masks, right? What are we going to do with masks? Because we all saw the pictures from the White House over the weekend where the people were all right together and they didn't have masks on, and now they have a COVID-19 outbreak. So we're trying to think, do we need to have our masks on? And you know what? I think their guidance is a little bit confusing. I'll let these guys talk about it because they're smarter than I am about this. But also, what about the 6-foot rule? And let's just check it out. Because here we go. I'm going to go first to my left because we've done this, as you could guess. Look at that. We're pretty far apart. Now let's look at Hawkinson. Oh, man, we are right there, right at 6 feet. So we're more than 6 feet. So you could argue whether we need to wear masks or not. We know that it's hard to understand us through the microphone. But it's also Universal Masking Day. So Dana, what are your thoughts?
I mean, I think in general, again, out in public, in the workplace, wearing a mask is going to be important when you can't maintain that 6 feet of distance. And again, these masks, now these are biomedical grade, except for Amanda's, which,
It's the cool cloth mask.
Get out right. But they are meant to protect other people from you if you are having symptoms or may not be having symptoms and could possibly be spreading the disease. So again, I think, yeah, we are together for some amount of time, but we are also spread apart and even further than 6 foot distance that's recommended.
And I was really hoping that it was going to help me get through the introduction without stumbling on a word, but the mask did not help me, so I'm a little disappointed about that. Amanda, what do you think? Mask or not unmask?
I think that the mask really provides what Dana was alluding to, the source control. So it's keeping my droplets closer to me so that I'm not spreading them to other people. This is not a biomedical mask, it's a cloth mask, so it's not personal protective equipment. I think any time that you're going to be, either you know that you're going to be around people or there's a chance that you could be around people. I was speaking to somebody in an office space earlier today, and I said that she really should have a mask on. She said, I'm just sitting at my desk, but people come to her desk often. So that's kind of the challenge if you're in an area where you're at a desk where people can come to you, like if you're at like a front desk, because you can't always maintain that 6 feet social distance.
So I promise right now I'm not to come over to you and not to talk or breathe on you or spit at you. Earlier today, she thought, well, are you going to spit at me? And I said, no, I'm going to try and avoid that.
I would also like to mention we do have adequate stores of hand sanitizer.
Everywhere.
I think this is still the rigor.
It's still the rigor.
So
yeah,
we are doing this frequently throughout the show as well, and also avoiding touching our face.
And I took a shower this morning just in case anybody wanted to know.
With soap.
With soap, and I washed my hair.
We also wipe down.
We wiped down this whole place, and we're good about stuff like that. So what are our numbers today, Dana?
So the numbers have gone up a little bit over the weekend. We are sitting at 28 today as of early this morning, with 11 of those in the ICU. But it's still in what we are probably going to be considering our equilibrium, our steady state, about 20 to 30 patients. If we can certainly get lower, that would be better. But if we have to maintain that number of patients rather than a large surge, especially now as we start to maybe loosen things up and open up a little bit, I think that would be an okay thing.
Amanda, it's a big day today here in the metropolitan area. Things start to open up a little bit. Mm-hmm. What are we telling people?
So,
besides wear a mask.
Obviously here in the health system we have gone to universal masking, but out in the public, if that's your question as to kinds of things of what we can do if we're going to be out in the community, I think it is critical. I carry hand hygiene or hand sanitizer in my car.
Oh my God.
Specifically as you go to the...
what about...
Yeah.
All the time.
Always have it with you. Well, in the health system, we have so much hand sanitizer available to us that it's easy to find it. I think that's another. So always having hand sanitizer with you, especially if you're going like to the grocery store, that's something that we're all doing. Yeah. Making sure that I wear a mask when I go to the grocery store. It also helps to remind me not to touch my face when I have a mask on. So that's, you come into contact with the environment, and then the likelihood of getting transmission there is when you touch your face. So I think the mask also provides a great reminder not to touch your mucous membranes. Always wiping down surfaces. I know we have plenty of that as well in the health system, but I think keeping us safe in the community is wearing a mask and washing your hands and not coming into contact with your face.
Okay, so here's what I'm going to do. I know that I'm more than 6 feet apart from the two of you, and so the CDC says I'm okay, I think, to not wear it, and I'm going to sit back. I'm not going to spit at anybody today, although my kids may not always think that that's the case. And so I'm going to take it off because also the people can't understand us as well. So that's a problem I'm trying to keep. So I'm going to take mine off right now, but I'm going to put mine right back on as soon as I get done with this program. And I have my little spot right here to do that with. Now, Amanda, she's going to keep hers on because she's better than I am. I already knew that. So, questions that you may have out there this morning. What's going on? So, Dana, one of the questions that I would ask all of us is, how do you get your groceries? Where do you go?
Yeah, I was actually going to mention that as Amanda was talking about. So even at our grocery store, at the checkout counter for the employees, they do have alcohol pump. And it's, certainly ask them, but it's always good to maybe take a pump of the alcohol hand sanitizer as you're leaving that and to kind of clean up. So where do I go? I go to the hen house. And so I went yesterday, and many people are wearing a mask, still not everybody, so that's in Johnson County. We'll see how it goes as we get further into this. But they do have the guards up, the plastic guards at the checkout. They also have everything marked off of being 6 feet apart when standing in line, and so that's how it is.
So where do you go?
So I go to Hy-Vee typically. One of the things that I noticed this weekend is that not everyone is wearing a mask and not everyone is following the one-way signage.
Oh yeah, they don't ever do that.
And you can't control everyone, so I follow the one-way signage, even though it is extremely inconvenient when you just need something at the end and you have to go all the way around in a circle. I think something that is, and Dana and I actually talked about this last week, one of the most when you go to get your fresh produce and you can't get the sack open, normally I would lick my finger. Well, I can't do that anymore because I'm wearing a mask in there, so I spend probably 8 minutes trying to get the bag open.
Yeah, so I go to either the Price Chopper or over there in Brookside or Cosentino's or over to Whole Foods. And I'd say the mask wear is about 50-50, and it's tough. When I get home, I tend to wipe down my groceries with one of those little alcohol wipes or whatever. But then I rely a little on the refrigerator to help me because I know the refrigerators are not great environments for viruses. Thoughts about that?
Yeah, certainly. I think that, certainly cans and bottles, it's, been recommended or consensus maybe to do that, again, out of an abundance of caution, wipe it down with alcohol or a Clorox wipe if you can find them, or any other cleaning material. You could do that, I guess, to chip bags as well, as those are non-porous, wiping those down. The other thing is we talked about vegetables and fruits. Probably just washing them off as you would wash them off normally is probably okay. Again, a lot of those other things, cans, bottles, chips, bags of chips, things like that, are probably going to be in your home, in your environment for 1 or 2 or 3 days, probably before even starting to getting to those, eat those. By that time, the viral concentration is probably going to be very low, and it's probably really going to be rendered non-infectious at that point anyways, as we're talking about days. So.
Did you guys know that washing carrots is bad for them? They turn really soft in the refrigerator after that.
There's
That's
lots of produce that...
Not to use soap and water.
Yeah, I tried that. My wife made fun of me because the carrots were no good within like 24 hours.
And again, I think we have to go back to as long as this has been going on and people at different times have taken different degrees of caution, we're not really fully aware of any cases of COVID that have been spread by people who have brought things home from the grocery store. Certainly, I think contracting it at the grocery store is very likely, but bringing things home, and if you're doing those other things out of abundance of caution, you should really pretty much be safe.
Okay, here's my big thing. I am a nose itcher. I have a few allergies out there, and my nose is always itching. You wear a mask, and you're trying to rub it through the mask. Is it okay to use my sleeve of my shirt? Because that's what and I see you do that too there. Gartner. Don't try the knife. I watch you
Yeah,
do it.
absolutely. So I think when you think about how likely are you going to be to touch like the inside of your sleeve with your other hand, and then, I mean, like if you're gonna wipe your nose like that, it is better than using something closer to your hand where you're more likely going to touch it, if that makes sense.
I have watched you do some contortions to try and get over there and do that, so that's what you're saying. So sleeves are okay, is that what I'm hearing? Is that a consensus?
Yeah, absolutely. I mean, I think we know that the high-touch surfaces are going to be the palms of your hands, fingertips. So really touching, if you have the itches, I think is reasonable. But otherwise, if you can't, especially if you have itchy, dry eyes, maybe from allergies, again, it's going to be vitally important to really wash your hands with soap and water if you can. If you don't have soap and water, certainly use alcohol sanitizer before touching any other parts of your face, especially with your palmar side, your fingertips, things of that nature.
You know, I think at some point we just have to recognize this is all about relative risk and not absolute safety. Absolute safety is give me the bubble wrap and I'll just stay inside, and the only time I'll come out of the bubble wrap is take a shower with soap and water with no one else around me and then go back inside the bubble wrap. So being that is pretty difficult to do, you really have to find out how you can be as safe as possible. And that's what we're trying to really do is here's the recommendations for being as safe as possible. And each person has to determine their own level of risk. So who's in your bubble? Guys, who's in your bubble? My family's in my bubble. I let my kids come over. Don't give as many hugs as I would like to do, but I know that they're sheltered in place because they're studying or doing whatever. And so that's kind of my bubble with my wife. How about y'all? Who's in your bubble?
So I think that I have like a bubble at work.
That's true. I have a bubble at work too.
There's a couple of folks that I spend more time with. But again, we're not hugging. And I'm still wearing a mask most of the time. I know I spend a lot of time with you guys and Lance and other members of the infection prevention and control team. And if we're in a small space, we're absolutely wearing masks. But if we're in a bigger space where we can spread out, not wearing masks.
Well, you know, I work with the CF team, and I've mentioned before the nurse who I work with, and so that's inside a bubble, inside of them, with the same rules you're following there. And then the office where I work, it's kind of like, oh, that's kind of a bubble because you got to respect each other, and you got to trust those people to what they're doing. Dana, what do you?
Yeah, I mean, and we are lucky here too, in the fact that a lot of our meetings where we do meet, if it's not by Zoom, if it is in person, we do have that space to separate. So
Yeah, in fact, we've
changed
changed our conference rooms, which normally seat 30, are down to seating 10. And I think that's big. That's a really big difference because we're allowing that social distancing to take effect. And now we're saying you ought to wear masks unless you're in between rooms. And I think theoretically inside the conference room, what do you think about that if we're all spread apart out there? See, I keep putting her on the spot today. Well, these are the hard questions, though.
Sure, and I'm gonna always recommend that you wear a mask because somebody may stand up and walk by you, or they may. I mean, you don't always know when you're going to cough or sneeze, so that's something that I'm wearing a mask to protect you, Steve. That's why I'm going to wear it.
All right, I appreciate that. So, who do you know? Or is there a safe way to hug somebody?
Oh.
Somebody
I
who
think
may
this
not
could
be
be
right in your bubble.
debatable. You know, I mean, certainly, you know, again, if we're talking about loved ones, family members, we know that there are other issues going on. There are people with family members in hospice care, or people with family members who have chronic illnesses that they want to see. As we break it down to relative risk, it's important for that touch and that hugging and being with those loved ones. I think you can make it safe, and again, a hug is a very short period of time, but I think there are ways to make it safe in those circumstances.
Again,
for sure.
it's about relative risk, right?
Absolutely, and I think even in the healthcare environment right now, when you're talking about the patients that you're speaking of, both the patient and the loved ones or family members are probably also wearing a mask, again, to keep their droplets closer to them. But absolutely, you can do it safely.
Yeah, you know, it is thing.
I have two questions. One of them is a follow-up to that, and that comes from me. How do you make it safe? You're saying you can do it safely, but how? What would make a hug with someone who's inside your bubble or near your bubble? And we're going to talk about bubbles. here a little bit later too, but what would make it safe? Do I wear a mask? Can I hold my breath and turn my head the other way and they turn theirs? What makes it safe?
I think if you're in the healthcare setting, you're gonna both have masks on. I think if you're not having your face turned to one another, that's also an opportunity to make it more safe or less likely that you're gonna transmit droplets to one another. Yeah, you can absolutely do that.
Yeah. And again,
So turn it. Okay, I like that one.
Channel 41, one of the reporters said, I'm not dialed in this morning, but could you ask this question for me? And I said, sure. She said, this morning, must be an early morning reporter, saw a group of 8 friends sitting at the same table for breakfast, no masks, while the rest of the tables in the restaurant were 6 feet apart. Aren't those friends taking a risk by sitting so close? Define that risk.
Yes. Oh,
So-
define it's harder. Go ahead.
Well, I don't know how to
They're
define the risk.
they're definitely taking a
exactly.
risk.
With the risk, right? What are they risking?
So if you're sitting at a table, obviously Dana and I right now, if we were sitting at a table and we were eating, the likelihood of our droplets transmitting infectious disease to
You'd
one
have
another is
really have
probably
like that watermelon seed spitting contest. and so-
right.
Yeah, that'd be
But typical tables at a restaurant or in a home are not this far apart. So sitting closer to a large group of folks is probably fairly risky, especially if you're not wearing masks. And
Especially
it's
8
difficult.
people coming from different environments
Absolutely.
into who aren't around each other. Clearly an
Absolutely.
intersection of 8 bubbles.
Yeah, and it's very difficult to keep a mask on while eating, so probably not a good idea.
So Dana, talk a little bit though, those driveway moments that you're seeing people now, to steal a term from NPR, the driveway moments where people are kind of far apart and sitting around having a meal or drinking, having a beverage or something, are those okay outside? Right?
Yeah, I think outdoors, again, we would like you 6 feet, but I think if you can maintain further than 6 feet, 8 to 10 feet, in an outdoor environment, if you're not sharing drinks or bringing drinks from your house to give to somebody else, I think that's reasonable. Again, if you are maintaining under that prescribed amount of people, whether that's 8 or 10. And it also, we've talked about this, adults, it's pretty easy to maintain distance. Children are a little bit harder. They're horseplay, wrestling around, running around, chasing each other. So that's a little bit more difficult, but I think in an adult setting, that is certainly a little bit easier to do. And again, we're talking about outdoors where there's, now if you're talking about a restaurant, the other thing is not only the droplets, but we have talked about fomites or inanimate objects that can spread the disease. So say it's a coffee creamer or syrup and it gets on there and you are using it, maybe your friend has it but doesn't know that they have the disease yet, and those droplets end up on there and then you are taking it to pour syrup on your pancakes or something like that. That's another way that the virus can spread.
So I have a buddy, I want to go fishing with him, and I got an old Sequoia. It's got like 250,000 miles on it, and it's 17 years old. So it leaks a lot of air no matter what you want to do. If he sits in the far back and I sit in the front, it's more than 6 feet apart. Or is that safe? We want to go fishing sometime.
I think you're probably fine. The likelihood of him coming over 2 rows of seats, or you're facing this direction and it going backwards, is probably unlikely.
And the ventilation system inside cars, especially roll down the windows, man, it sucks a lot of
Especially
stuff.
rolling down the windows,
window
yeah.
there. Yeah, a little pop top up. It kind of creates the airflow going up, I think. So I think there are ways that, again, this is all about relative risks. If you want to use bubble wrap and not go out, then you can do that. But I don't know if that is a humanly possible thing, because you have to balance the different needs you have as a person against that. And I think one of the things that happens when you listen to all public health people, they're going to say, oh, you have to do all these things. But that's great, but it's not real health. And you have to cope with what's real health. And so our advice is really trying to aim at, here's the things that you can best do to work on real health. And I think that may be a little different sometimes.
And I think it's important too, we try to promote the best, the ideal, because we know that humans like to fudge and like to, well, if I can do this, then why can't I do this? If I can go 6 feet, why can't I do 5 feet? There's nothing much different, or 5.5 feet. So we really try to aim for the optimal, the gold standard, so that everybody can try to adhere that, because we know in general a lot of people probably won't do those types of things.
Other questions out there?
Yeah, this is Nate. I've got a couple questions. There's some people who are wondering about possibly over sanitizing. Somebody was asking, how is cleaning everything going to impact our immune system? And just somebody else just wanted to know, are we sanitizing too much? How will this affect our susceptibility to other sicknesses as time goes on?
Well, that's an interesting question,
Yeah.
but one I don't think we have to be too afraid about because there's still a lot of bugs out there, and your body is loaded with bugs. So let's talk a little bit about that, Amanda.
I don't think that there's a risk of over sanitizing. I think these are all really good practices that we should be doing despite COVID, cleaning the surfaces, because there is, who knows what else is on the surfaces that we touch frequently. And again, the best thing that we've known for years to prevent infection is good hand hygiene practices. So I think those are not things that we can overdo. And as far as its impact on our immune system, I'll probably ask Dana to answer that one.
Yeah, I mean, this is a great immunology question. There was some information going around that we can't be not hugging, not handshaking. We can't be washing our hands all the time or being clean. We certainly recommend that you be clean. That is not how our immune system works. And as Dr. Stites alluded to, there are plenty of things that we have access to that our immune system gets primed with every day, whether it's internal antigens or organisms, whether it is breathing those in. Again, certainly we've talked about this before. In Missouri, we do have a lot of antigens and pathogens in the air that we breathe in daily, things like aspergillus. There's also other things such as pollen that we bring in, and that helps our immune system to sample the outside environment. The other thing is we know that we probably aren't going to be hand sanitizing and washing all the time. We know that there are plenty of organisms that have been found to be cultured on things like money and other surfaces that we aren't doing. So really doing the hand hygiene that we're talking about in the frequency that they're talking about, or cleaning surfaces in the frequency they're talking about, is not going to decrease your immune system at all. And especially, this is probably going to be a short thing, and most people probably don't do it to a great extent, but you really don't run the risk at this point in time of any deleterious or short-sighted effects over your immune system by doing those things that we're promoting for public health at this point.
So really, when you talk about money, you're talking all about all the dirty money that you're handling, and really what you have to do is money launder and get it.
That's
cleaned
right.
up. That's pretty good.
Anybody can anybody want to do that?
Not bad. Nate, did you have another question after that? Just to say, not to mention, don't forget, a lot of us may have cats or dogs. I have this cat, Hoshi, my daughter, and it was supposed to have it. Now I have it. It's a great cat, and so we have Hoshi dander in our house, and it's actually that turns out to be another thing that really primes your immune system and gets you ready. There's a lot of data out there about whether or not having pets helps young kids to develop an immune system. But once you're older, your immune system is pretty darn developed. And again, we've got viruses and fungus and bacteria all over our mouth and our gut, all over our body. Don't think we have a shortage of it. No. I'm not too worried about that part.
You won't hurt your immune system.
Nope. And just think, people in very rural areas who may not see anybody for days or whatever, they still have an immune system. So the logic is really not very good about having to worry about washing too much. Next question.
So I did have another question for you. So I'm going to combine a couple here. Somebody was talking about how after June 15th in Kansas, we may be all clear. So does that mean that we won't have to wear masks and maintain social distancing?
Time out, Nate. Let's be careful about that phrase, all clear. Let's just say.
I know. That's just what they wrote, but I totally get it.
There's a lot of steps between here and there, and there's a lot of ifs, ands, or buts out there, and that doesn't mean we're going to be all clear of virus, because if we're all clear of virus and everything's safe, I'm going to Kauffman Stadium. I'm just saying, that's what I'm doing. But I don't really think we believe that we're going to be all clear, guys. What do you think, Dana?
I like to be a realist. I'm pragmatic. We understand as well as other places have opened up around the world, and even around the nation a little bit, that they are starting to see more cases. We have to expect, with the nature of this virus, with this infection, that we will continue to see cases. There was a report on CNN just yesterday about some birthday party in California that there was somebody coughing who was joking about, I probably have COVID. And
they did.
And now you have 40 or 50 people infected because of that. So I think we have to understand that the
Why
virus
were there
is going to
40
be
or 50 people at a birthday party in California where they've had a lot of COVID? Come on. What are we thinking?
Well, I think that's where we have to be very mindful of, just because some of the regulations have changed and we can go out into the community. It doesn't mean that we can't, we still have to be very aware of the risk of spread here. So it's still important to maintain small group gatherings, wear your mask when you're going to be in a public setting, continually being aware of clean environment, washing your hands. Because the risk is still there, just because they lift the stay-at-home order.
It is, and I think what we have to remember is that you're doing it for yourself and you're doing it for all the people you're in contact with. Mm-hmm. And we've seen what happens when COVID gets into a small environment, whether it's a birthday party, a nursing home, or a meatpacking plant, mm-hmm. or any place else where there's folks congregated together. The risk is still the same risk. It's still there. And I think COVID's still going to be around SARS-CoV-2 and thus COVID is still going to be around come June 15th. The rules haven't changed just because the calendar did, right? You just got to think about that. Say it again. The rules haven't changed just because the calendar did. And what you still have to do is think about what is the personally responsible thing to do. It's not up to the politicians or anybody else to tell you how to live your life. The reality is that, and we know the economy needs help. Okay, got that. But you got to do it in a way that's mm-hmm. smart. Yeah. And you have to do it in a way that keeps you healthy. Because making yourself or others unhealthy isn't going to make the economy better. What's going to make it better is being here in the long term. So we just have to be thoughtful. We've got to balance those things. We know the political leaders do that, and they're trying to figure out this economy versus health thing. What we're saying is, even as life opens up, which I want it to do, we all want it to do, and I want to go fishing, you still have to go about your life in a way that is personally responsible. Mm-hmm. So, okay, next question.
So we're
Hi, this is Taylor at Channel 41. Can you hear me okay? I'm sorry, I didn't know if it was coming through.
Go ahead.
Can you guys hear me okay? Okay, so just making sure. I have a question about youth sports. I just got a notification this last weekend about my kids who are 7 and 5 to start getting ready for baseball to start and for practices to begin, that kind of thing in Johnson County. And I promised my wife I would ask the doctors this morning what we should do. So this is a definite what would you do kind of question here. What should be the right call with youth sports right now?
Yeah, what would we do for youth sports? That is a great question. Okay, Amanda, I'm going to start with you this time.
He said doctors. No, I think...
yeah, but you're the one who really knows this content. You have the content.
So I think that there is still, obviously, there's still a risk of spreading. So I think when you talk about baseball, there's not that close interaction whenever you're playing. Now, when you're practicing and when you're sitting on the bench as you're waiting to get up to bat, I think there's still potential need to wear a mask in that situation. But when you're in the outfield and you're out there by yourself and you're clearly more than 6 feet away from somebody, I mean, baseball is probably, the risk of transmission there is probably the baseball itself.
Yeah, well, and just I think the close contact.
And the close contact.
Because I think the problem part isn't that it's baseball, it's that you just brought a bunch of 5 to 7-year-olds together. Mm-hmm. And let me ask you this, would you let that happen in another environment? Are you going to bring 5, if you're okay with bringing 5 to 7-year-olds together in any environment, because 5 and 7-year-olds are not going to respect social distance. I don't care what you do. No. Unless you put hula hoops around everybody. It's a really big hula hoop. So, they're outside, and the problem is you got 5 and 7-year-olds together. It's not if they're playing baseball. I don't care if it's baseball, basketball, soccer, water, polo. I don't care what it is. You got 5 and 7-year-olds together.
Yeah, I think that's the thing. It's hard to really delineate between tennis, dive, swimming, soccer, football. You know, the fall's coming, so football is going to be very important, whether it's baseball. I think the good thing is you are outside. But really, if you're having young people try to maintain the physical distancing, that's going to be very difficult. I think we really need to, and it's going to be different too in our area here because of, Casey, Mo, Jackson County, Johnson County, Wyandotte, all the different counties, which will have a little bit different regulations of what they allow or not. That's going to be very hard. I think it just, again, goes down to individual risk. Do you think you can do that? The other thing is, are you driving home for carpool? So when my son has soccer, I drive 6 other boys home, teenage boys who are 13 years old in my minivan. So am I going to have them? Am I going to be driving
You're
them
just a
home?
cool dad.
I mean, it gets satellite radio. It's good. I've hauled a lot of things in that. But that's the other question you get. So it's not only the event where you're playing the game, but also practices and things of that nature. And I think that it's hard to tell right now. It's very difficult. We have to wait to see where we go with opening up and then taking that individual risk on.
Yeah, I think that's really the key. And so my answer to you, Taylor, is: are you okay with having a bunch of 5 to 7-year-olds hang out together and then take the virus around? Because they'll be asymptomatic. The kids are going to be fine. It's where they're going to take the virus to. So that's really the question. As you can probably tell from my tone of my answer, I'm thinking it's not such a great idea yet. I honestly think it's a little premature. But it's because of that, and because the virus is still, and I don't know when it will necessarily be safe. If you look at what I think sports are going to go to, we're going to have salival testing sometime in the next month or 2 months, 3 months, something like that. I think that'll be a bit of a game changer. And I think if it's rapid, like the flu test is, and it can be done within minutes, if those things are true, then I think you can create a condition in which sports can be safer. But I think that's going to take something like that to help us with infection prevention. Otherwise, we're going to end up right back where we started from. And so my answer to youth sports is, yeah, I'd be real careful with that myself.
What do you think of organized sports with face masks and face shields on?
Well, I want to see that under a helmet. I guess it could happen for football. I don't know. What do you think?
I don't know. There was a very good opinion piece in Jam Open Network a couple weeks ago by Dan Deacon out of University of Iowa, where they had proposed, what do we move to? Because we understand that face mask or face shield, which can be very easily produced and have been produced, thankfully for us, by a lot of digital printing here around the city, are pretty easy, but they reduce the amount of viral particles by 90%. They are an extremely good method of reducing that. I think that if you're parents sitting on the benches watching the baseball game or watching the soccer game, that's reasonable. Obviously, not for the athletes, but for people who are kind of congregating together to watch. It's not an unreasonable thing to start to think about, especially if we want to get back to Arrowhead and we want to get back to Kaufman. There's things that we have to consider and keep it all on the table so that we can eventually get back out there.
I think,
what do you think?
Well, I was going to say that the risk of, even if you do the testing, you can, that negative test can then, that's good for right now, but tomorrow it doesn't mean anything.
Again, yeah.
So if you do have somebody who then eventually comes back testing positive, and anybody who meets that exposure criteria and they had their mucous membranes exposed, now you've taken out the entire team. And that's, I think, a big consideration for the team sports.
Yeah. Okay, Taylor, do we make you feel better or worse? Which side of the fence were you on?
I don't know. I was more on the yes, and then my wife is the one that was. I asked her yesterday. I said, "Hey, so we need to talk about baseball. What do you think?" And she immediately said, "I don't want my kids to play." And someone else, we asked some other parents last night, and the best answer I got was, "Hey, they're 5 and 7. Are they going to be any worse off if they miss one summer of baseball?" And that, you may have made a believer out of me there.
I think your wife's pretty smart, but that's kind of how it is at my house too.
Well, no, I know my wife's very smart. There's no thing to that. I know that. It's not how smart she is; it's how dumb I am capable of being. That's the big question in our house. So thank you for your answer. I appreciate it.
It's part of the story. Okay, others out there.
So we're talking about going back into the office. Well, there's a couple going back into the office.
Safe.
So what role does central air conditioning play in spreading the virus? And if employee workspaces or offices are at least 6 feet apart, do they need to wear masks in the office? And also there was one about restaurants. Should wait staff wear masks?
Oh, I'm going to take the easy one. So wait staff should wear masks and preferably face shields and gloves when they're serving you. And you got to really be thoughtful about how you do that and how you get your food, guys. I think that's a big challenge for restaurants.
And have a lot of, with gloves or without gloves, taking off gloves, had a lot of hand sanitizer available for those wait staff and those servers.
Yeah, I think I'm probably a bigger proponent for not wearing the glove, just because I have a feeling that when people wear gloves, they have this false sense of security that their
Right.
hands are actually cleaner. So I'd rather good hand hygiene practices versus gloves.
But face shield and mask you're good with?
Yeah, absolutely,
Yeah.
especially if they're interacting with
Yeah, absolutely.
like groups,
Yeah,
absolutely.
and the servers to bring the food to you, or
Yeah.
I think that makes a lot of sense. What about going back to work? What do you think about a cubicle that is 6 feet apart? You got the cubicle, things are more than 54 inches tall and all that.
I think it's the habit that we form at work that, they are your bubble. So you just get so comfortable going up and leaning up against your cubicle because I have a quick question. This isn't going to take very long.
Right.
And I think there's just this natural tendency to let your guard down. So I think, and that you may or may not agree.
Actually, I do agree.
That we should have masks on. If I like, my office has a door and I can shut it so I can control who's coming in and come out. But when you're in a cubicle setting, you don't always have that luxury. So I think depending on how many other folks are in that space with you, if there's only a couple of other people and you can talk without getting close proximity, you maybe don't need that mask. I think in shared office spaces where you might be using the same telephone, how critical it is to wipe it down and to wear your mask.
Yeah. Dana, what do you think?
Yeah, and I don't think we have a lot of evidence about the air handling. I don't think that's as much of a risk as being more in close proximity to one another in cubicles, or going up and talking to somebody at a cubicle. So I don't think the air handling, I know that a lot of places are trying to install new air handlers to really purify and clean the air and things of that nature. I think that's fine to do, but again, we are still talking mostly respiratory droplets rather than actual airborne spread, and so that's the important thing to note there.
And so let's break that question down just a little further. The question is really, am I safe to go to work? And then the answer is really the same answer we give everything. You have to evaluate your circumstance. It is a question of personal risk. And what can you do to make your environment safer, whether you're in a cubicle or not? If you're worried about that, then the safest thing you can do is to wear a mask and then a face shield. And that will, if you do that in a cubicle 6 feet apart, you're probably pretty darn safe. But you have to then keep washing your hands and doing all those other things. But the simple reality is it's hard to live life in a bubble all the time. It is really hard. And at some point, we're going to have to confront this risk. And the risk is going to be there now or later until we have vaccination and effective therapy. And that could be 6 to 18 months away. So as we've kind of flattened the curve now, we don't have the surge that's overwhelmed the hospitals. We've not been New York or Italy. Then I think you can make a pretty good argument that it's safe to get back to work with a face shield and mask on and washing your hands as long as you can be 6 feet away in a cubicle. Okay, I can live with that. I can live with that. I guess I didn't mean that in a sense of irony, but I think that is probably a reasonable expectation. But all those things we just said have to be true. Mm-hmm. And you have to decide on a personal level, are you willing to take that risk, knowing that not only is there work, but at work there may be an elevator or a stairwell or a break room or a bathroom. That's what you just got to be really careful about and constantly wash your hands and take care of your personal hygiene. Other questions? Oh, we're probably time for one more question here, I think. We're right at our time. Anything else out there? Burning question.
Oh, there's always a burning question. Somebody was asking about dorm living in colleges. Do we think it'll be safe in August?
Well, I'm going to hang my head down on this one. All right, guys. What are we thinking, Dana? As he reaches for the disinfectant on his hands, go ahead.
Well, we know that dorm living has historically been pretty dangerous, whether it's meningococcus or meningitis or other infectious disease, because you are congregating together. And so I don't know if the universities are going to start looking at new ways to do dorm living. I think right now it's really too early to say. Again, we do know that younger people, so probably college age, probably for the most part, as far as the numbers go, do okay and don't have the risk factors of significant illness. But we know that in a place like a dorm or a fraternity or a sorority house, infectious disease, those types of things can spread very quickly. So I think it's too early to say. Right now, I would say I probably wouldn't do that, especially if you're expecting to go back and forth to home every couple of weeks to see your loved ones, your family. But right now, I think it's probably a little bit too early to say, because they're even looking at reducing classrooms, and that's only for an hour at a time. So if you're thinking about a dorm living where you're there most of the time, it's probably pretty dangerous.
Amanda, what are you thinking?
I would tend to agree with Dana. I think it's really too early to answer the question. Dorm living promotes group interaction, and I think that's the risk.
Yeah.
So I don't know. I think universities have a tough decision.
Well, and then you take that same, you're in a dorm, then you go to a classroom. The classrooms are often pretty crowded, and then you're in front of your professors who may be like me and be, a little older and be a little bit more at risk, and then you can spread it around. I think that's just hard. That's feeling more and more like a meatpacking plant, and less like I've got a safe bubble out there, and I think that'll be our challenge. So tomorrow, we welcome in Heather Harris and from our Hayes Medical Campus, Christian Whittington, who's from Pawnee Valley, and Mark Van Norton from Great Bend. And we're going to talk about, has the pandemic made healthcare safer, especially here in Kansas? What's it like out there? What's going on, not only here in the city, but out there? I really want to thank, of course, Doc Hawk, who's here with me, but Amanda Gartner, who keeps us all square and straight. Thanks for coming into this in today. And I want to say to all of you all out there, remember, even as we begin to leave home, even as we begin to take off the shelters, there's still this question of personal responsibility, and there's still no place like home. We'll see you tomorrow.